This is a pattern I discovered probably 15-20 years ago. And I started to palpate the medial aspect of the sit bone. And then I added spring testing or stress tests, medial and lateral, to each sit bone. And on my client Gina, you'll notice that the inside of the right sit bone is about 1 inch away to the crease of her body. And the pants crease matches her buttock crease. You'll notice that it's much closer, my right thumb is much closer to the midline, whereas the left has a deeper space. But this is only how it looks. It's much more important to find out, could it be that the body developed this way? Or is this a movement dysfunction from her fall on the ice? And I can do a superior stress test and I get movement going through the SI joint. I can do an inferior stress test and I get movement through the SI because I see the whole leg move. Okay? But when I do a medial stress test on this sit bone, there's no movement going to the right. When I do it on the inside of the right sit bone, there's no lateral mobility. There's no medial mobility. And there's no lateral mobility here. However, there is anterior spring mobility through that ischium and pubic joint and SI joint. So this is what I call a lower windswept pelvis. And there's also an orthopedic fracture that's called lower windswept pelvis. But anyway, this is a movement dysfunction, and it's not the way she's developed. It's in response to a trauma, and we will treat her, and we should be able to get much improved symmetry. But more important than how it looks is how it moves. We should be able to restore movement, and coupled with that pattern, the ligaments pull on the coccyx, and this left side of her coccyx is deeper, going up towards her ear. And so the coccyx has little wings at the first coccygeal segment, and then the tip is down here. And so if it's side bent to the left, then there'll be a deeper left side versus the right side. Okay? So again, this is called a left lower windswept pelvis. It's a pattern I discovered by palpating the lower part, and also by developing those spring tests, found that it's lacking movement in all directions. And you might also find asymmetry of ligament tone. The sacrotuberous ligament feels like bone. It's supposed to have a little bit of yield, and the sacrotuberous ligament on the right does yield. I can spring that ligament. So we definitely have a very tight sacrotuberous ligament on the left. So I'll stop filming now. I have other videos on this that shows the treatment technique, so I'll just treat her and come back and film the response to treatment.